Achilles tendon pain is a common condition. It's common in runners, it's common in basketball players, and it's also common in soccer as well. In this video, we'll go over everything you need to know about Achilles tendon pain. So, what causes Achilles tendon pain, how it's diagnosed, whether you need imaging or not, and also what treatments are most effective for treating Achilles tendon pain. It makes sense that we should start off with what causes Achilles tendon pain. So the Achilles tendon is a tendon on the backside of the heel, and it attaches your calf muscles to the bottom of the foot. So the calf muscles consist of the gastrocnemius muscle, the soleus muscle, and also the plantaris muscle. And so all of those taper to form the Achilles tendon, which then wraps around the bottom of the heel. When the Achilles tendon gets overstressed, it can lead to pain in the Achilles tendon. And this overloading on the Achilles tendon can lead to multiple structural changes. So it can lead to thickening of the Achilles tendon. It can also cause blood vessel formation, which has been implicated in chronic pain syndromes. And then also it can lead to disorganization of the actual tendon structure. And these structural changes actually decrease the stiffness of the Achilles tendon and also decrease the strength of the tendon, which is why exercise is so beneficial in treating these conditions, which we'll talk about later. But it's also important to know that these structural changes don't have a good correlation with pain severity. So that basically means that you can have all of these changes, but you don't necessarily have pain in the Achilles tendon. The terminology used to describe Achilles tendon pain has really kind of transitioned quite a bit. We used to use the term tendinitis, which would refer to inflammation of the tendon, which is a little bit of a misnomer because inflammation isn't actually the main driver of these conditions, it's overloading. And so we've actually transitioned to using the term tendinopathy, which refers to just pain in the tendon. The diagnosis of Achilles tendinopathy can be made with a good history and also a solid physical exam. In the history, there's usually a sudden spike in load on the Achilles tendon. So whether that's someone who just started running for the first time, or maybe they had a big soccer tournament, the load on the Achilles tendon suddenly spiked, which led to the development of pain. The physical exam usually shows some sort of pain with loading. So whether we do a couple heel raises or maybe a couple hops, that will reproduce the symptoms of Achilles tendon pain. There's also palpation directly on the tendon, so touching right on the tendon just above the heel bone, that can also reproduce some of the pain of Achilles tendon issues. There's also an orthopedic test called the Royal London Hospital test, and in that test we'll do the palpation, so we'll touch the Achilles tendon with the ankle just at rest, and then we'll actually flex the foot up towards us, so we'll dorsiflex the foot, and then palpate again on the Achilles tendon. If the pain decreases, that's indicative of a tendinopathy and not another condition of the Achilles tendon. Imaging usually isn't needed for the diagnosis of Achilles tendon pain, although it can tell us a little bit about the actual structure of the Achilles tendon and help rule out some other conditions that present similarly. Usually an ultrasound or an MRI can be used to look at the structure of the Achilles tendon, but the problem is that some of these structural changes found on these images don't correlate well with the severity of Achilles tendon pain. So that's generally why we don't recommend using imaging for Achilles tendon issues. And the reason is because it doesn't really change the course of care. So unless the results are actually going to change the course of care, the information is usually nice to have, but not necessary. And finally, let's talk about treatment options for Achilles tendon pain. The treatment intervention with the most evidence behind it is exercise. And so I actually made a video specifically on exercise programs for Achilles tendon pain, and I'll link that up here and then I'll also put that in the comments below. But what they basically concluded was that either an eccentric loading program, which is where you'll slowly lower the heel down towards the ground, or a heavy slow resistance program, which is where we'll do a concentric contraction up, lifting up the heel, and then a slow contraction back down towards the ground. Both of those were effective treatment options for Achilles tendon pain. Another treatment option which has moderate evidence behind it is activity modification. So as long as we're not dealing with an acute flare-up of Achilles tendon pain, complete rest isn't necessary in the treatment program. So that means that we can still exercise, whether that's doing a little bit of running, playing basketball, or playing soccer, or whatever sport it is, as long as the pain is within tolerance. And essentially what that means is that we want to keep the pain level below a 4 or 5 out of 10 and make sure that the pain doesn't persist 24 hours after the exercise. There are other treatments that have weak or very little evidence behind them for the treatment of Achilles tendon pain. One of those treatments is orthotics, and there were 2 systematic reviews, so 2 reviews that looked at all of the literature on orthotics for the treatment of Achilles tendon pain, and they concluded that there was no additional benefit to using orthotics. Another common treatment is manual therapy, so whether that's joint manipulations, mobilizations, or soft tissue work, there wasn't much evidence to support the use of that for the treatment of Achilles tendon pain. And finally, taping. So whether that's kinesiology tape, McConnell taping, athletic taping, whatever taping it is, whether it's an elastic-based tape or a rigid-based tape, they found very little evidence for the use of taping for Achilles tendon pain. So to summarize the treatment interventions, exercise and load modification have the best evidence behind them for the treatment of Achilles tendon pain. If we need to, we can use manual therapy, taping, or orthotics if those other treatments aren't effective in decreasing the pain and restoring function, so getting you back to whatever sport it is you want to do. In conclusion, Achilles tendon pain is an overload condition, meaning that there was too much stress on the Achilles tendon, which led to the development of pain. The diagnosis is usually just made with a good history and a solid physical exam, and imaging typically isn't necessary for the diagnosis of Achilles tendon pain. When we look at treatment, exercise and load modification are the primary treatment strategies with the best evidence behind them, and then if necessary, we can also use taping, orthotics, or manual therapy to help supplement those other treatments. Thank you for watching this episode on Achilles tendon pain. I hope that you found this information useful. If you did, let me know in the comments below, what was the treatment that was most beneficial for you? Don't forget to give this video a big thumbs up, and if you want to see more of my content, don't forget to hit that subscribe button, which I think it's on this side, but it could be on this side. I'm pretty sure it's on this side. Go ahead and hit that subscribe button.